Good evening. Welcome to Healthline. I'm Suzanne Watley.
And I am Gregory Zarian. So, have you ever had a surgical procedure that has left a scar that you are embarrassed about, that you were tired of answering the question, what happened? Did it hurt? Are you okay?
You might be interested to know that there is a surgical procedure now where one incision is made in the belly button, and this abdominal operation takes place with special instruments. We have a short video to introduce you to the surgical procedure that is taking place locally right now at Glendale Adventist Medical Center. The procedure is known as SILS.
In single incision laparoscopic surgery, I make a single incision within the belly button so that there's nothing that can be seen after the operation.
There were no stitches. In terms of pain, it was minimal.
What he's doing is one incision inside the belly button, which nobody can see.
Patients are able to recover quicker from the operation. They're able to go back to work.
One of the reasons we chose SILS is because I have a 4-month-old baby.
My name is Sam Carvajal, and I'm one of the general surgeons here at Glendale Adventist Medical Center.
Dr. Carvajal was great. He made me feel very comfortable.
He was very comforting, and the procedure was awesome. He did a great job.
The majority of the patients that come to my office who require abdominal surgery are candidates for single incision laparoscopic surgery. And in fact, 95% of the laparoscopic operations that I perform are single incision laparoscopic surgeries. I'm using this technique to not only remove gallbladders and the appendix, but we're able to also fix inguinal hernias, remove parts of livers, treat the liver for cancers. All of this is done without any scar. The advantages to patients are not only that cosmetically you cannot tell you had an operation afterwards, but more importantly, they're able to get back to their actual life.
You can go back to your family, to your work.
We formed a training program here at Glendale Adventist Medical Center. I have no doubt that within 5 years, this operation will be available all over the nation, but it's currently available now at Glendale Adventist Medical Center.
At Glendale Adventist Medical Center, our heart specialists understand you have questions about the health of your heart.
At Glendale Adventist, they fixed my daddy's heart.
At Glendale Adventist, they fixed my heart.
We offer the latest cardiac services and technologies. Do you know your heart health? We are Glendale Adventist Medical Center, healthcare at a higher level.
Welcome back. We hope you enjoyed your little field trip experiencing SILS, single incision laparoscopic surgery. Joining us in studio is Dr. Sam Carvajal, and joining Dr. Sam is
Amy Chudacorn. She represents Covidien, which is the manufacturer of the SILS port and the instruments that Dr. Carvajal and other SILS surgeons use in these operations. Welcome.
Thank you. It's so great to have both of you. Doctor, how excited are you and Amy with the partnership in regards to Covidien and SILS?
Well, it's absolutely amazing. I literally could not have done this operation and have advanced the operation as far as we had without this partnership. Amy and I were in this partnership from the very beginning, even as we went together to go watch one of the very first adopters of SILS do an operation. And we saw that, realized what needed to be changed and how to advance the procedure where we're at right now. And Amy has advanced so far in her corporation that she is now the Western Region Ambassador for SILS.
So Amy, tell us the history of the SILS port.
Okay, well, it was interesting because we stumbled upon this as we met a number of different surgeons internationally. We found that they were using different ports and operating in the belly button. So from a company perspective, we saw an opportunity. We started to develop a product, which is now the SILS port, and brought it to market.
And Dr. Carvajal, how did you introduce yourself to this surgical technique?
Well, as I stated earlier, Amy and I watched an operation that predated the SILS port, just done through a couple of small trocars or small tubes that we put inside the belly button. And in fact, that's how I did this until we started with the FDA trials at Glendale Adventist and other institutions across the United States using the SILS port. And with that SILS port, the operation has blossomed into this amazing place we're at right now, where nearly every laparoscopic operation that is done can be done through the SILS technique.
But isn't it fascinating that something that was created by happenstance is now the talk of Glendale in every surgical procedure locally and across the country?
Yeah, everybody is talking about this because this is the future. This is where we're going to be, and you can't do any better than one incision. So this is truly the it, and as surgeons finally start to master this technique, I am quite certain that all of the nation and all of the world will be using this technique from now on.
And why aren't hospitals using it right now? What's the learning curve, for example? What's the investment?
Well, it's difficult for surgeons to first learning how to do this. It changes your mind and how you're thinking. Covidien has been amazing at sponsoring other physicians to try to learn how to do this operation, and through Amy's work we bring physicians always and quite often to Glendale in order to learn how to do this particular operation. And so it's difficult, and it's going to be a long time before we get to that goal where it's available everywhere, but we'll be there.
So Amy, within that then, how do you find the doctors that then get a study under Dr. Carvajal? Do they come to you or do you approach them?
Okay. Well, typically the reps, they assess the skill sets of the surgeons that are in their territory. And then from that point, they register their surgeons into the course with Dr. Carvajal. And once they attend that course, then they go out and they go ahead and start their SILS procedures.
So once they graduate from Dr. Carvajal, they get to then fly on their own.
Exactly.
Okay.
We'll be talking to an OBGYN who has studied under Dr. Carvajal and is now employing the SILS method in his practice. Thank you, Amy, for being on the show.
Thank you, Amy. I'm here at Glendale Adventist Medical Center, where world-renowned surgeon Dr. Sam Carvajal is performing SILS procedures all day. 15 doctors from across the country have come in to study and learn and hopefully master under his tutelage. Okay, so we just got out of surgery, as you can see, and you just removed the gallbladder of a woman that was 89 years old. How long did that take, Sam?
I don't know. I think the operation's maybe about 15 minutes long.
And before the SILS procedure, how long would it take?
It'll be about the same, and that's the important thing about the SILS procedure, is it really isn't a longer procedure. It's equivalent to thing. It's very, very fast, and it causes the least physiologic impact in the patient. So therefore, the patient's less likely to have secondary complications such as pneumonias, heart attacks, and this is important in this age group. It does not add bad things, it just adds good things to the operation.
Here I am with Amy Chudakorn, who is the representative from Covidien. Thank you for being here, Amy.
Thank you.
So how is today going in regards to the SILS procedure and all these doctors and Dr. Sam Carvajal?
Well, this is our biggest event yet, and so far it's been a huge success. We have 12 attendees. I think because single incision has grown tremendously, these doctors are really starting to see the value in it.
How were doctors chosen to participate in trainings like this?
What our reps do is they handpick the surgeons.
Okay.
And they need to make sure that they can assess their skills, make sure that the doctors have the ability to complete a procedure like this, and then they come to the course.
We're trying to innovate. We're trying to create the techniques that we can teach other physicians so that they can be successful in their practice. Nothing short of complete adoption of SILS across the world is acceptable.
In regards to you in teaching, what do you find is the most efficient way to teach?
Well, we think the SILS course, like we're doing today, where physicians travel from all over the country and they fly in, this gives them the knowledge base that's necessary to take this into their practice and start to utilize this technique. And these are accomplished surgeons, and they just need to learn a slightly different technique.
It was so awesome to watch Dr. Sam Carvajal teach 15 doctors how to master the SILS port. Advanced surgical procedures is part of the conversation happening here at Glendale Adventist Medical Center, and it's all about you, the community.
Welcome back to Healthline. We are talking about a groundbreaking procedure that is taking place at Glendale Adventist Medical Center, the surgery method known as SILS. And Dr. Sam Carvajal has been doing this for quite some time now and is training other physicians, including our other guest, OBGYN, Dr. John Artinos. Dr.
Welcome,
Artinos?
Doctor.
Thank you.
What got you involved in OBGYN?
Well, the whole package, pretty much. Delivering babies and doing surgeries together is the most gratifying experience that you can have as a physician. So I knew pretty much early on that that was my calling, and that's what I pursued.
You wanted to bring miracles into the world.
There you go. That's
and
right.
Why did you decide to employ the technique of SILS in your practice?
Well, when a new technique comes out, I look at it and I look at what makes sense to me. And this is a technique that really made sense to me. A single incision laparoscopy versus our traditional laparoscopy, which would involve multiple incisions. One incision in the belly button that virtually is not detectable after surgery. So which woman would want surgery with no incision?
Why is it particularly an issue for women?
Well, women are more cognizant about cosmetic
They're worried about how they're going to look, right?
Exactly. So as such, they wouldn't want anybody else to know that they had surgery. So if they can have a major surgery without any scarring, I think that's preferable versus major scarring.
And what kinds of surgeries do you use it in?
Pretty much anything that we do traditionally in traditional laparoscopes, so hysterectomies, total hysterectomies, any kind of ovarian cysts, ovarian cystectomies, oophorectomies, removal of ovaries, ectopic pregnancies, tubal surgeries, tubal ligations. All those can be done through SILS.
Do you find it, you studied under Dr. Carvajal?
That is correct.
Do you find it, Dr. Carvajal, hard to teach an OBGYN?
No, not at all. We are teaching urologists.
Or train.
And we're teaching OBGYNs. One of the most successful OBGYN practices in doing SILS is somebody that we've trained, and that person's now training other GYN surgeons. So it's something that's multiplying. And so yeah, we're happy to have all specialties enjoy all the benefits of SILS.
That's awesome.
Dr. Artinos, what is the biggest challenge of learning to do operations through the belly button?
Well, through SILS, you have to really retrain your mind on how you're doing this surgery. In traditional laparoscopy for hysterectomies, for instance, you start off laterally in the abdomen and move towards the midline, where the uterus is. For SILS, it's exactly the opposite. You start in the middle in your belly button and you move laterally, and you have to cross in order to do that. So it's rewiring, rethinking of how you're actually doing these procedures. And once you get it, it's fairly simple. So that was the most. That was
you smile.
Yeah.
Once you get it.
That is the major challenge, is to actually think about the whole process and change change your thought process in doing these through one incision.
Well, it's kind of like what we discussed with Dr. Carvajal prior to this show. It's kind of like learning how to drive on the other side of the road.
Well, that's right.
It's like you know the idea, but it's just getting there differently.
That's correct.
Do you find that some women prefer the old traditional surgical procedure that you can offer other than SILS?
Well, if you offer SILS versus a traditional, pretty much every woman has chosen SILS. Why wouldn't they? If you have one incision versus multiple incisions, and you can do the same and have the same results, or even better results, less pain, less scarring, quicker recovery, I think the answer is very simple.
I find myself wondering, if you do a hysterectomy, how do you get the uterus out the belly button?
Well, you don't. You get the uterus from below, vaginally. So that's how. So it's a SILS assisted, if you want to call it, like a laparoscopic assisted vaginal hysterectomy. The same thing with the SILS, but instead of having the 4 different incisions, you have one through the belly button.
And Dr. Artanius, you have to go deliver a baby. Okay, when we come back, we actually have a patient joining us who has been under the guidance and care of Dr. Sam Carvajal. Don't go away.
Hello, my name is Dr. John Artinos, and I am the chairman of obstetrics and gynecology at Glendale Adventist Medical Center, and I'm here to talk to you about single incision laparoscopy. I am proud to offer single incision laparoscopy to my patients. Because it's only one single incision, it causes less pain, and the recovery time is a lot faster for the patient. So single incision laparoscopy can be used for pretty much any procedure that is done with a traditional laparoscopic approach, like total hysterectomies, ovarian cystectomies, ectopic pregnancies, tubal ligations, and endometriosis. For more information on single incision laparoscopy, please call Glendale Adventist Medical Center or visit their website.
I am a swimmer. I am a dancer. I am a mother. I couldn't be me without the Spine Institute at Glendale Adventist.
Their renowned specialists provide everything from physical therapy to advanced surgical techniques for your neck and back pain. Glendale Adventist Medical Center, helping you get back to life.
Back here on Healthline, Jody Parrish, a SILS patient, joins us, and you're a patient of Dr. Carvajal's?
Yes, I am.
Tell us about your SILS experience versus laparoscopic experience that you had.
Okay, well, I had a baby in December.
Yay, little one.
And about 6 weeks later, had major pain, found out I was having a gallbladder attack. Immediately called my doctor, got in for an ultrasound, decided I needed to have emergency surgery because I was going to be traveling to Australia. They got me in right away, had the procedure, and I was on a plane 6 days later headed to Australia.
Wow. Were you familiar of SILS prior to your procedure?
Working at the hospital, I had heard about it, but I never had thought that I would be utilizing it so soon.
Were you apprehensive, or you're like, let's just do it, I've got to get on a plane and I'm going to Australia?
Well, talking to Dr. Carvajal, he answered all my questions, eased my mind. Being a new mother, I was worried about being out of commission for a while, but with SILS, it was not a problem.
How does it compare to laparoscopic surgery?
I had a couple previous procedures done that way. I think this one, the healing time was a lot quicker. Recovery was a little easier, a little less painful all around.
Fewer incisions?
Yes, hardly anything. You can look and you can't even tell. I didn't even have any stitches.
So you're bikini ready?
Well, still working on a little bit of baby weight, but
you're looking great, but you're on the right path. Dr.
But
Sam,
I could.
Dr. Sam, we're friends, so I can say that. Do you find that it's most successful when patients ask questions and talk a lot about it, as Jody said that she did prior to the surgery?
Absolutely. We encourage patients to ask questions, to look into all of their options, and because of shows like Healthline and all of the other information that's out there, patients are coming in ready and willing to have SILS and knowing about it, just like Jody did. And so it was actually a very easy thing to ease them into this new technique.
Can you take us maybe briefly step by step through how you would remove a gallbladder, for example, using SILS?
Sure, absolutely. It's quite simple, to be honest with you. We simply make an incision inside the belly button. I concentrate very hard on making that incision so it's just inside of it, so there's nothing that can be seen afterwards. And then we make an incision in the linings of the muscle, which allows us now access to the abdomen. We put that SILS port into that belly button. And I think you could see that in the video that we were looking at earlier.
I've actually witnessed it live.
And then we put the instruments and the telescope through that. We're able to separate the connections that are to the gallbladder, which includes an artery and a duct. We do that with metal clips. And at the very end, when it's all been separated, we made sure that there's no bleeding. We simply go ahead and grab that gallbladder and bring it out through the belly button along with that SILS port, and we just close that incision at the end.
And you never actually put your hand inside the patient?
Never, except for that very first part when we're putting it in. We're just making sure everything's clean and free on the inside, but otherwise this is all done telescopically.
And cosmetically, Dr. Sam made sure the belly button was visually perfect.
It's
to a surgeon to a T. Any pain, anything at all?
Minimal pain, just took it easy for a couple days, but like I said, I traveled to Australia 6 days later. So wonderful, fabulous.
Jody, it was a pleasure having you.
More on the SILS procedure when we continue here on Healthline.
At Glendale Adventist Medical Center, our heart specialists understand you have questions about the health of your heart.
At Glendale Adventist, they fixed my daddy's heart.
At Glendale Adventist, they fixed my heart.
We offer the latest cardiac services and technologies. Do you know your heart health? We are Glendale Adventist Medical Center, healthcare at a higher level.
Welcome back. Dr. Sam, what is the future of SILS?
The future of SILS is all of surgery. We're not going to stop anything short of being able to do the vast majority of operations that are done, including chest and abdominal operations through this technique. I've even thought about even charting to do things and introduce orthopedics, changing some designs on some of the equipment so that that can even be done through this kind of technique. It, again, will try to minimize the scar, bringing everything down to one incision, making patients heal quicker.
So then you're constantly trying to find new avenues to incorporate SILS into all type of procedures.
Yeah, just last week we did 2 new operations that have never been done in the history of mankind using the SILS techniques and innovating and developing these techniques and teaching other doctors how to do that.
So the complexity of the operation is only limited by your imagination and your skills.
Absolutely, and as you get very skilled at this operation, your imagination blossoms.
How successful have you been in getting the thoracic surgeons on board with SILS?
Not too successful yet, but we're working on them.
Do we think in the future that we'll even patients will even be able to get their tonsils out with SILS?
I don't think that's necessary because you just remove that from the mouth.
I know, but I'm just trying to just up the ante.
What about
go ahead.
Children?
Children.
Are they candidates?
There are spleens that have been removed in small children using this technique, slightly modified and not using the SILS port. And so it only is a pediatric surgeon's imagination to be able to think of new ways to use this technique in different kinds of operations on pediatric patients.
What about in utero, operating on a baby before it's born using SILS?
Very good.
I have trained with some of the world's experts at that particular technique, and one of the things we're hoping to do is to introduce this technique for them and using intrauterine surgery.
Your mind is already so running.
Absolutely.
Jody, any comments to anybody that questions whether or not traditional or SILS?
I'd say SILS is the way to go. It's just with recovery time and pain, so much easier, and with no scarring, it was amazing.
It was a pleasure. Dr. Carville, how can people find you?
Well, I think the easiest way is to go to Glendale Adventist Medical Center's website or call the operator there, and they'll be able to tell you how to get a hold of us.
And just ask for Dr. Sam.
And
Absolutely.
Glendale Adventist is the only hospital in the area that's doing this?
It's not the only hospital. There are other hospitals in the area that are dabbling and doing a few operations, and we've trained most of those surgeons how to do this. But it is the one hospital, really across the entire country and worldwide, that has the largest experience and in the breadth of surgery that can be done through this technique. And so it's really become a world leader.
Dr. Sam Carvajal, Jody Parrish, thank you for being on Healthline.
So great to have you. Thank you for joining us. Thank you for spending your half hour with us in regards to the way of the future, and thank you for test driving the SILS port. On behalf of Suzanne Wally and myself, have a great evening, and remember, the most important thing you have is your health. Have a great night.
Good night.